Well, let's take you to the US now, where the number of confirmed coronavirus cases is approaching 2,000, with 135 deaths. Tackling the outbreak has been made harder by the large number of people who can't get medical care, either because they don't have insurance or they're undocumented migrants who may fear that going to hospital could lead to deportation. The situation is particularly acute in the South. Aleem Maqbool has been to Tucson in Arizona to find out why.
This mobile clinic really is just a drop in the ocean, trying to help at least a few of the many millions of Americans who can't access health care.
I have not seen any evidence that anything is going to be different with the coronavirus. For years and decades, we've been okay as a society, knowing that there's so many in our community who are uninsured or underinsured. And we've been okay, and we're going to pay the public health price because these individuals without access to care are going to get sicker, are going to spread the disease more frequently because they're not getting care, not isolating, not getting diagnosed and treated.
Even Americans who do have insurance often don't seek help because of the additional costs involved.
We were getting sick a lot, and taking my children to see their pediatrician, it's like $100 each visit. Just for a check, and then to tell them, or for them to tell me no, that they can't prescribe anything, that it's just a virus, go home and heal from that.
As well as the huge numbers of people across the United States who don't have any health insurance, and the many more who, even though they do, are still worried about the cost of seeing a doctor. In border cities, there are millions of people who are afraid to seek medical assistance because of their immigration status. Many have been here since they were children, but still don't have US citizenship. Some told us they were scared to go to a doctor.
Being undocumented for sure is hard in itself, just seeking medical attention, but then there's also the aspect of presenting yourself to the legal system that they even have at some medical facilities. They have sometimes you have to present yourself to authorities, and that runs a risk of potentially being deported.
Add to all that the fact there's no requirement in the US to offer paid sick leave, and you have a dangerous backdrop that could all exacerbate the spread of the coronavirus here. Aleem Maqbool, BBC News in Tucson, Arizona.